Hi, I'm Brandon Leonard, Director of Strategic Initiatives with Men's Health Network. And today I'm speaking with Armin Brott, who's a member of the Men's Health Network Board of Advisors. Thanks for taking the time to speak with me, Armin.
Great to be here.
So, Armin, you're a fatherhood expert, and I'd like to get your thoughts on the connection between father involvement and reaching out to fathers and then men's health.
Yeah, I think it's a great topic because I always see the two as being really part of the same continuum, that you can't separate out fatherhood and men's health, that they are completely woven together. And I started looking at this a long time ago and didn't see that connection. And then I began to see that looking at the data and doing research and working with fathers and working with men's health, that it's so all-encompassing. So you've got to give you a couple of examples. So fatherhood, when a guy is involved with his family, he tends to be healthier himself. Guys who are actively involved with their kids, with their family, they tend to do less stupid stuff that gets them landed in jail. They tend to stop smoking or give up bungee jumping or sell their Harley. They do things that are going to take better care of themselves. They say to themselves, look, I got places to be. I can't just be jumping off of cliffs or smoking. I got to take good care of myself. And it's nothing like seeing your 2-year-old running around smoking a pencil to get you the idea that I got to make some changes here. And when dads are actively involved with their family, that also spills over onto the moms. They have less to do. There's much more job sharing, load sharing, and so women who are involved with men who are actively involved with the kids have a tendency to be happier in their lives. They can actually go out and they can go back to school. They can take on different kinds of hobbies and have a life that's a little bit more rounded, more fulfilled. And then there's the stuff that I think is really the most interesting, which is the impact that involved dads have on their kids. And it starts from actually before they have kids. It starts during pregnancy. One of the biggest predictors of low birth weight babies is stress, maternal stress during pregnancy. And low birth weight translates into all sorts of health problems throughout the lifespan. But one of the things, if a man is involved during pregnancy and he helps his wife or his partner go to the doctor, get prenatal care, take good care of herself, get exercise, eat right, that kind of thing, she has much less stress and she's much more likely to carry the baby full term, and that generally is associated with a healthier outcome for babies. So the complete package, fatherhood, men's health, women's health, baby health, it's all really so much tied together.
Can you tell me a little bit about how you got involved with Men's Health Network in the beginning and then some of the work that you've done with the organization since that time?
I got involved, it was the weirdest thing. I wrote an article, the very first thing that I wrote that ever got published. It was about the portrayal of fathers in children's literature, and which was pretty negative, I thought, and it really hasn't changed that too terribly much. And I got a call out of the blue from this guy with a big, heavy Texas accent. Turned out to be Jimmy Boyd, who is the executive director of Men's Health Network, and he said, interesting article. If you're interested in doing some stuff about fatherhood, I'll send you some stuff. And you've been on the receiving end of some of Jimmy's packages, and I just got so much stuff, and it just completely sucked me in the most positive way. And it's been a really wonderful 20 years, basically, we've been working together.
Can you tell me about some of the challenges that you see in reaching out to men, whether to talk about fatherhood issues or to talk about their health, and then some of the successful strategies that you've seen to work for that?
Yeah, I think one of the biggest problems or the biggest challenges in reaching men, particularly young men, is figuring out where to get the messages to them, how you're going to get the messages to them, because men and women don't respond to the same sorts of things. And this is a great example, I think, if you look again at the connection between fatherhood and health. If there's a parent-teacher association or some sort of a message gets sent home with the kids, if it says, here's a parent activity, or please come, this is a parent event, men have a tendency to look at that as mom. It doesn't say parent, it doesn't say dad, it says mom on it, even though it says parent. And so they tend not to respond. So we need to be doing specific outreach to men. And we also need to be doing things in doctors' offices. I think a lot of doctors' offices or healthcare provider offices are not set up for men. So you go into a pediatrician's office and there's lots of kid magazines and the decor is kind of feminine, and there may be articles on nursing bras and different things like that. And there's nothing for guys. They just don't feel comfortable there. Or they'll be sent home with a piece of paper that says, here's the vaccination schedule, and it's a pink piece of paper. I mean, those things sound silly, but they really do make a tremendous amount of difference. Men need to be approached in a guy-friendly sort of way. And I do. I teach classes for expectant fathers, and I had to have the hospital change the class name from expectant fathers to for expectant fathers only, because every once in a while I'd get an expectant mom who'd come in and she'd want to be there for the class. And I think it's a great thing, except I discovered fairly quickly that the guys in the class will not talk about what's going on with them and about the concerns that they have if there's a woman in the room. So we really need to be able to come up with ways of getting messages through. And it's not only the delivery mechanism, but actually what's being said.
Okay. I'd like to talk with you a little bit about men's health and how we know that by many indicators, men are doing pretty poorly. Looking at dying of higher rates, and then 9 of the top 10 causes of death. We talk a lot about the kind of impact that has on families, the impact that has on the men themselves. But I was interested to see that you had recently led a study and written a paper that was talking about the economic impact of men's health disparities. And could you talk a little bit about the work that you did, what you found out from the study that you did?
Yeah, that was something that came out of frustration, and I'm sure you've had some similar frustration. I've been writing about men's health for a long time and saying a lot of the same things, which I think are very important messages, just what you said. Men die younger, at younger ages. They have generally sicker lives. They don't respond. They don't go to the doctor when they need to. When they go, it's often too late, that kind of thing. And I realized after all this time, as horrible as this will sound, people in some ways just didn't care about the message that men are dying younger. So I thought, well, what if we take a look at this from a different perspective? Okay, you don't want to care? That's okay. But let's talk about how much this is costing you. And I got a lot more people doing double takes and actually paying attention. And when you realize that men's health is costing us a huge amount, just to get men as healthy as women, there's no problem, there's no question that women could be healthier as well, but just to get men as healthy as women, how much money are we losing in income tax because these guys are either not working because they're so disabled or because they're dead those 5 years earlier that they die? And when they are disabled, how much are we paying out in Social Security benefits to these guys? If they die in the workplace or they die someplace else, how much are we paying in Social Security survivor benefits to the widows and people? And then there's a really interesting thing that happens, which is something like 80% of women who are in poverty or widows who were in poverty, were not poor before their husbands died. And so we have, when their husbands died, the women's life is very much affected. And so we have all sorts of welfare payments and food stamps and the SNAP payments that go to women. And it's an unbelievable amount of money. And then you've got the whole thing about, that's the public sector, just in tax revenues and things. If you look at the private sector, how much is lost in workplace productivity? How much is lost in people taking off sick leave when they really aren't sick? And so putting all of those things together and going through the data, and I had a whole bunch of people who were working with me. It was a great team of people who were really going through the data and analyzing this stuff. And it turned out, really and truly, it's about $450 billion a year, that we are spending unnecessarily, that we could cut that back. And one of the most wonderful things out of this whole study was looking at, okay, so what do we do? So it's going to cost some money to be able to get men to pay better attention to their health, to go to the doctor when they need to go to the doctor. And we found a lot of data that was showing that for every dollar that's spent on workplace wellness programs or public sector wellness programs or private sector wellness programs, that you get back anywhere from $1.25 in reduced costs up to $4 or $5. Wow. So it's a big thing, and I think we're having these discussions culturally about healthcare reform, and it's going to be front burner for a long time. And we really need to be taking a look at this, just this one thing. It's not a magical cure-all, and we're not going to get that whole $450 billion back, but I think it's a number that is so powerful that we really need to be paying more attention to that.
Okay, great. And what do you think would be the top priority for something that we can do to improve that?
Oh boy, I would say public awareness campaigns, that to get out there and say, you need to be taking better care of yourself. And I think one of the approaches that we've kind of knocked around a little bit with Men's Health Network is to say something a little jarring, which is, look, okay, you don't want to go to the doctor, fine, don't go to the doctor. That's not too terribly smart, you really should go, but you don't want to go, okay. Your kids, however, need you in their life, and your wife or your girlfriend needs you. So if you're not going to do it for them, at least take on the provider-protector role that you like so much and do it for them.
Okay. All right. Armin Brott, thank you very much for coming to speak with us.
Thank you.
Appreciate it.
Beer.